Hi. Intermittent fasting and exercise. This is what I understood from Professor Mark Mattison. Mattison, M-A-T-S-E-E-N. The intermittent fasting is not a diet. It's not a dieting. It is eating pattern, meaning you eat in a restricted time during the day. It could be 6 hours, 8 hours, or 10 hours. During that time, you could eat meals at certain time and not to eat all the time. You could eat 3 meals, 2 meals, and better 1 meal. Of course, this needed training. It will take 2 weeks to a month, and some people, perhaps more, you will feel irritable, hungry, but it is worth it to train yourself to do intermittent fasting. You could have water, black tea, black coffee, anything without calories during your fasting, mainly carbohydrate, because this will increase the sugar in the blood, carbohydrate, and increase insulin hormone in the blood. So, intermittent fasting, if the eating window is 6 hours, then you will fast for 18 hours. If it is 8 hours, you are fasting for 16 hours, 16-8, and so on. That needs training. The benefit of intermittent fasting and exercise are the following. After 12 hours, the liver will deplete its glycogen, and then there will be a metabolic switch to tell the fat cells to break down the fat, which is called lipolysis. Lipofat, lysis meaning breaking down. And then the fat cells, the mitochondria in the fat cell will start to burn the fat, and this is called beta oxidation. So you start to burn the fat into carbon dioxide and water, and this is how you lose fat. The fat, when it is lost, it will become gas, carbon dioxide, and water. And this will help in the long run to lose body weight. So intermittent fasting is very useful for people with obesity and high body weight or high body mass index, patient with diabetes type 2, and patient with cancer who are on chemotherapy and radiotherapy. Why? Because cancer cells live on glucose and sugar. So if you starve them, they will be not growing so much, and then they are exposed to the toxic chemicals of chemotherapy and also to the toxicity of the radiotherapy. So the patient will respond better to chemotherapy and to radiotherapy, and this is proven by clinical research on human. Most of the experiment about longevity and intermittent fasting is done on animals, rats, and even monkeys. And sometimes the life will extend even up to 50% if it is combined with exercise. So now the benefit of intermittent fasting is weight loss, and also the metabolism. The fat will produce ketone. Ketone is a clean source of energy for the brain cells and for the heart cells. The metabolic benefit is it will regulate, the body will regulate the blood sugar level and decrease insulin resistance, meaning the person will become insulin sensitive. And this is very healthy. Also, it will affect the brain. It will produce BDNF, brain-derived neurotrophic factor. This factor is a protein produced by the neurons to decrease the excitability of the neurons and decrease depression. And also, it will increase the neuroplasticity and the synapses formation. And it will improve cognition, memory, and it is very good, especially in the short-term memory center, which is the hippocampus. It will be increased in the health of the neuron in that region. So now it is metabolic health, mental health, cardiovascular health. The heart will beat slower and the blood pressure will become normal. Also, the increased heart rate variability, meaning the heart will become more adaptable to respond to stress, physical stress, or even emotional stress. So now, intermittent fasting, it has so many values because of this metabolic switch and because the liver is empty of its storage with the glycogen. So it is mental health, cardiovascular health, longevity, metabolic health, and the ketone also are anti-inflammatory, as well as it is a good source of energy, and also it will affect on the mitochondria to produce uncoupling. Uncoupling means it will help the mitochondria to dissipate the extra heat produced from its work. The intermittent fasting has the same pathways as the exercise. Exercise is also stress, and it is very important to do it. It will be very healthy because it will signal healthy pathways, and sometimes it is even better than intermittent fasting. So if you do both, then it is very good. What is the difference between intermittent fasting and calorie restriction diet? Calorie restriction diet, there are experiments that people reduce their calories by 20% in every meal. They lose weight, but they don't get the same metabolic response as the patient or the people who do intermittent fasting. Why? Because the liver will not empty itself from the glycogen, and there will be no metabolic switch. The main thing is the metabolic switch. People on calorie restriction, but they eat many times during the day, they will lose weight, but of course, they will lose weight if they eat less, but they will not be as healthy as people who do the fasting because there will be no metabolic switch. So that is why we advise people to eat at certain time and stop. There is no snacks. There is no eating all the time. This is not good and not healthy. Also, the contraindication to intermittent fasting is if the woman is pregnant, patient with diabetes type 1, and those people who do strict intermittent fasting and don't do exercise. Exercise is very important with intermittent fasting so that you will keep your lean body mass and you will produce muscle mass. If you do intermittent fasting and resistant exercises and cardiovascular exercises, you will be healthier. This is the main point. To conclude is to fast and to get the metabolic switch and to do exercises. And also, if you sleep well, then you will get 90% of the principles of getting healthy. God bless you. Thank you and goodbye.